Hi, welcome everyone to our Cecilia Health webinar tonight. I'm Emily. I'm one of the coaches here with Cecilia Health, and tonight we're going to be talking about safe and smart exercises for people with diabetes. So you'll see here at the bottom there is a phone number. If you're having any technical difficulties, please reach out to 800-263-6317. So thank you again. Um, here as we get started here tonight, just to let everyone know, this is an interactive program. And so this tonight, our webinar will include a short presentation followed by a chance to have more of a discussion. You will see underneath the questions section, there is on your webinar toolbar, you are able to type in a question if you have anything. And at the end, our presenter Sandy will have a chance to answer any questions that you may have. And so we just look forward to having an interactive webinar tonight. Now, as a disclaimer, we want to let you know that the information you are about to hear may motivate you to make lifestyle changes, but please do consult with your doctor before making any changes to your current routine. And the Cecilia Health Certified Diabetes Care and Education Specialist will provide strategies to help you manage your diabetes. This online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health Certified Diabetes Care and Education Specialist. So today our presenter is Sandy. She is one of our registered dietitians and also a certified diabetes care and education specialist. She spent most of her career in Central Texas helping people with diabetes of all ages meet their health goals. She currently resides in Colorado and enjoys the great outdoors, which includes mountain biking, skiing, and hiking as well. So, Sandy, thank you so much again for tonight, and I'll let you take it from here.
Thank you so much, Emily, and thanks to everyone who's joining us this evening. This is a topic that's near and dear to my heart. Again, my name is Sandy, and I'm a registered dietitian and a certified diabetes care and education specialist. Tonight, we'll be talking about physical activity and specifically for people who have diabetes. We'll be discussing some of the benefits of physical activity, a little bit about the research to support the claims of the benefits, and then a little bit more about exercise prescriptions, how much exercise is recommended, and then how to manage blood sugar with addition of exercise into one's regimen, and a little bit about how to adjust insulin, and then we'll have some time for questions, answers, and sharing. And again, as Emily mentioned, please do talk with your healthcare provider before making any changes to your diabetes treatment plan. As a diabetes educator, I've spent many years trying to help people become more active and work it into their routine. And so we all have challenges to keeping active in our sedentary lives. Some of the things we might hear when people are trying to figure out how to get exercise in is simply, I just don't have the time, or concerns about it causing low blood sugars. I just talked to somebody today who thought their exercise gym was just boring, or even other barriers such as not having enough money for a gym membership or perhaps affording exercise equipment. So there are very many challenges to staying active, but I believe with the right mindset and just brainstorming, people can really come up with some ways to get more active, because the benefits are really quite huge. We know that exercise helps the cardiovascular system, so it affects so many parts of the body, the heart, the muscles and bones. It's just a good strengthener all around. It can help control blood pressure, can help control cholesterol, which again can help with the heart. And then it can increase metabolism. It can help with weight management in that way. It can actually give people energy and then provide better sleep. It can help to decrease chronic pain and may lower blood sugar, and we'll find out later. It may also raise blood sugar, but we'll talk more about those specifics as we go. One thing that exercise does for blood sugar control is that it really helps insulin work. With exercise over time and just sticking to a regimen, the body can become a little bit more sensitive to insulin, so you might need less insulin to be able to get the blood sugars into target range. And exercising muscle, as we know, helps pull glucose into the exercising muscle without needing insulin. So it can help the blood glucose in that way as well. You may have heard about the Diabetes Prevention Program. This was a very large randomized clinical trial. It looked at people who had pre-diabetes, and so it was looking at preventing type 2 diabetes. And one of the takeaways from the study was that exercise as part of lifestyle was very effective in preventing type 2 diabetes. These studies were sponsored by many of the health organizations and have gone on to inform a lot of our practices today. But in the study, there were 3 arms. There was a placebo group that got no intervention. There was a group of people who were put on metformin, the medication, and then there was a lifestyle intervention group where people were coached on nutrition and physical activity and encouraged to get up to 150 minutes per week of physical activity by the time point of 24 weeks. So within that study, these people who had pre-diabetes and were in the lifestyle intervention group were 74% of those volunteers assigned to the lifestyle group were able to get up to 150 minutes or more of activity per week by the 24 weeks. So people really learned how to fit the activity into their lifestyle. And then a simplified screen for that results is that that lifestyle arm really had a much lower risk for developing type 2 diabetes over time. So that's the lifestyle group in the red, and then the metformin group in the blue, and then the placebo group. And you can see that the lifestyle group, which included people who had been coached on nutrition and lost weight, as well as incorporated their exercise, were 58% less likely to develop type 2 diabetes. And there was a risk reduction also with just the medication, but it was a significant change with the lifestyle intervention. We know that the visceral fat in the body, so the fat that's particularly in the abdomen, is one of the causes or challenges with people for metabolically. So if you have type 2 diabetes, the intra-abdominal fat tends to increase insulin resistance and also be related to other metabolic issues in the body. So we know that exercise can help reduce intra-abdominal fat, and that in turn can help reduce risk for diabetes. It can help with insulin sensitivity and reduce risk for heart disease. We have also learned over time that having a sedentary lifestyle is by itself a cardiovascular risk factor. So it's listed here as kind of equivalent to some of the other risk factors, such as family history, smoking, high blood pressure, high cholesterol, impaired fasting glucose, and obesity, just the sedentary lifestyle alone is a risk factor for cardiovascular disease. And this comes from the American College of Sports Medicine guidelines. If you're calling in and are not able to see the screen, it does show a cartoon with a doctor asking their patient, what fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? We are always trying to help people figure out how they can fit the exercise in. And I am fully aware that exercise is really one of the first things to go in our busy lifestyle. So we just really try to help people be flexible in thinking of how to get their movement in to their life, their daily routine, because it really is a golden key. It is helpful for all of the things we mentioned in the beginning, and it just, I think it helps mood and outlook and so many other things. However, we want to help people exercise safely, and so we do want to talk about how to proceed with caution. Sometimes we have things that kind of get in the way of our activity, such as arthritis, particularly in the knees, or back pain. Neuropathy can be a barrier itself to exercise, and other complications that may come along with long-term diabetes, such as Charcot's foot or retinopathy or vision impairment. So we can think about modifying different types of exercise for people who struggle with these types of conditions. And just another reminder, there is kind of a push for physicians to write an actual prescription for exercise, as we know that not exercising or being sedentary is just like smoking when it comes to health risks. And so moving more is important. And I kind of like to think about it as movement and maybe not so much as exercise sometimes. If exercise brings up maybe ideas of, intensity and pain or struggle, what we really want to do is help people move more and find ways that work for them. So there's a little bit of definition in our words that we use surrounding exercise or physical activity. So you might think of exercise as really being something you're purposefully doing to move the body, particularly a different type of program that helps to strengthen the heart, use the muscles, and that is sometimes has a duration associated with it. So exercise is sometimes thought of as something a little bit more thought out and planned and structured, where there's also just as beneficial in many ways is just what we might consider physical activity or activities of the day, whether that's gardening, walking steps during your job, doing household chores, vacuuming. That type of daily movement counts for movement as well. They just each have their own benefits associated. The American College of Sports Medicine does recommend for all adults to achieve 150 minutes of moderate intensity cardiovascular exercise per week. And so they recommend 30 to 60 minutes of moderate intensity 5 days per week, or if the activity is a little bit more vigorous, then shortening the time to 20 to 60 minutes and shortening the frequency to 3 days a week. whatever you decide to do, we encourage you to build up to the stronger levels of exercise to avoid injury. And just also know sometimes 30 minutes might seem too intense for someone. So it's definitely okay to do shorter bouts, or maybe that's a way you fit the exercise in, is to do 10-minute intervals rather than committing to 30 minutes all at once. So spreading it out through the day is certainly one way to reach that exercise goal. And then adults are encouraged also to do some resistance work 2 to 3 times a week. The types of resistance work, like using light weights or going to the gym and using the machines, are very helpful for aging with building muscle, keeping joints used, and then just keeping up a person's strength, and it can also decrease risk for falls. So again, starting kind of light, just always considering starting where you're just barely, lifting a little 3-pound weight or something. If you haven't been doing anything at all, you don't want to just go to the gym and work out really hard like this woman here. So starting out very light with light resistance, it's best for adults who have been previously sedentary or older adults, and then you can alter however many reps you're doing, or the increasing of the weights as you progress, and depending on what your goals are. So for improving health and improving blood sugar, again, it's 5 times per week, 20 to 30 minutes of activity. In order to lose or maintain weight loss, it may be that it requires a little bit more frequency or duration. So 5 to 7 times per week for 45 to 60 minutes might be recommended if you're really goal-oriented for weight loss and weight loss maintenance. And again, this can be divided into 10 minutes in the morning, 10 minutes in the afternoon to hit that 20 minutes per day, or some other combination. So one of the things that sometimes prevents people with diabetes from embarking on an exercise routine is fear of low blood sugar. And so we want to talk about that a little bit here, and because certainly blood sugars can go low during exercise, certainly depending on the person's type of diabetes and regimen. But let's first visit a little bit about what's happening physiologically. So, normally the body's working very hard to keep the blood sugar within a target range. And with diabetes, that is often disrupted. So people with type 1 diabetes do not make any insulin, and they are needing to give insulin in response to food and just normal physiology. And so sometimes if you're taking insulin by injection, you can get too much insulin in the bloodstream. For when you start exercising, then you start using up the glucose, and then you also have insulin on board, and that can cause a low blood sugar. People with type 2 diabetes may as well be on insulin, and so certainly if anybody is taking insulin injections or oral medications that cause the pancreas to release more insulin, then that could cause a low blood sugar during exercise. In addition to that, depending on the intensity or the length of the activity, there may be some additional fuel needed from carbohydrates. So the body's using kind of a combination of glucose and fat for fuel during any type of exercise. But carbohydrate by food or drink can help elevate the blood sugar and give the muscles more energy to use during an activity to potentially prevent a low blood sugar. We would consider a low blood sugar any blood sugar that is less than 70. However, some people may get symptoms with blood sugars that are still above 70 but under 100. So we would want somebody to treat a low blood sugar if it were 70 or less, or under 90 with symptoms. And what are symptoms of low blood sugars? They're shaky, dizzy, nervous, hungry, clumsy movement, certainly confusion. You've probably heard these symptoms before. And interesting, some of these symptoms mirror some of the symptoms you might have with increased exercise, especially if your exercise is intense or you're not used to doing a particular type of exercise. You could feel shaky, you could feel a little nervous or faint or hungry. So the thing to do if you have symptoms while exercising is certainly check your blood sugar. If the blood sugar is low, and of course, if you don't have a way to check your blood sugar, but you have these symptoms, you would want to go ahead and just treat it as though it is a low blood sugar. So we use the rule of 15, which you've probably heard before. A rule of 15 means you're going to immediately consume 15 grams of carbohydrate in the form of some type of sugar that's fast acting. So certainly something like 3 to 4 glucose tablets, or a half a cup of juice, 2 tablespoons of raisins. These are examples of things that are just going to get right into the blood sugar to raise it. And so definitely want to consider using something fast acting versus something like that has a little bit more protein or that has a little bit more fat, like chocolate bar is not really a good choice for treating a low blood sugar because it doesn't get in the bloodstream fast enough with the fat and the protein kind of slowing down the glucose entry. And we can talk more about other things that you might have to treat a low blood sugar, such as regular Gatorade or Powerade, not the zero or the sugar-free types, something like carrying Skittles or jelly beans while you're exercising is a good idea as well. So 15 grams of fast-acting carbohydrate, and then wait 15 minutes. Give that glucose some time to get into the bloodstream, and then check the blood sugar again. And if it is still less than 70, then have another 15 grams of carbohydrate, and then wait again 15 minutes, recheck the blood sugar. And just repeat these steps until the blood glucose comes to at least 70. And if you're checking and it's at 70 after treating, you just still want to be very cautious. You may want to double check again in 10, 15 minutes, make sure it's still coming up, because if you're going to still have to, if say you're walking and you still need to walk back home, we need to make sure the blood sugar is not going to end up going right back down. And we can also think that, well, low blood sugars are possible, but they're probably also preventable if we do a little work on the front end. So to reduce chances of low blood sugars before and during exercise, one of the best things is just to check your blood sugar before you start exercising. See where you're at. For blood sugars less than 100, it might be a good idea to eat a little 15-gram carb snack, a few crackers, a piece of fruit, a little cup of yogurt, a slice of toast, maybe a small banana. These might be good things to prevent low blood sugars. Of course, everybody's a little different in how they react to exercise, and things change over time as you get used to exercising. So I recommend checking blood sugar prior to exercise and seeing if you need how much of a snack you need, and just taking good notes. So every day checking before, checking afterwards, seeing what works best for you. And what is a low blood sugar after exercise? So again, mentioning checking the blood sugar before you exercise helps you know where you're starting. If you need a little snack or something beforehand, checking after the exercise and or during the exercise, if the exercise is prolonged, can give you an idea as to how your body's responding to the exercise, and did that snack you took beforehand help prevent the low, or did it make the blood sugar go up too high? And just keeping good notes is the key here. Again, because everybody responds to exercise a little bit different, and so just having the blood sugar information to look back on is super helpful. It is recommended, though, before exercise, if the blood sugars even say 110 to 140 and you're on insulin, you might need a little extra snack. We like that blood sugar. I'm sorry, if it's between 110 and 140 and you're on insulin, it's probably a good place to start. And above 90 if you're on oral medications, would be a good place to start. After exercise, blood glucose goals can be higher than 90 or above if you're on oral agents. However, if you're on insulin, you might want to have your post-exercise target a little higher, so like say 110, because the blood sugar is going to continue to come down even after exercise. So that's something to keep in mind. Once we stop exercising, the body's still working, the body's still metabolizing. It's replacing some of the glucose in the muscle that was used up for the activity. And so you're still getting glucose coming out of the bloodstream. And again, every type of exercise is different and everybody's body is different. So we only know how you've responded is by your blood sugar monitoring. Now, some people can get high blood sugars after exercise. And so the question here on this slide, if there's a high blood sugar post-exercise, do we give insulin to correct? That is something I would definitely be keeping records of, talking to your healthcare team about, but exercise caution here because, again, blood sugar tends to keep coming down after exercise. Sometimes blood sugars go up during the exercise because the exercise is intense and it's a stressor, and so the body's sending out glucose, and there's other types of stress hormones involved, and so you have a little bit more insulin resistance. But usually when you come into a resting state, the body's, again, pulling that glucose out of the bloodstream and back into the cells for storage. So be very cautious about giving insulin for highs that occur after exercise, and only after discussing with your healthcare team would you want to give corrections after exercise. So just a few other takeaways to reduce your chance of low blood sugars after exercise. Just remember that blood sugars can be lowered many hours after. We call that the lag effect. So you might need to have some carbohydrates beforehand. You might need to have some carbohydrates after your exercise. If your exercise is especially long or more intense, always check the blood sugar afterwards to see where you're at. And this cartoon is somebody going through the drive-through and saying, I was hoping you'd let me know how much more insulin I need to take if I decide to supersize my order. And I get this type of thoughts a lot surrounding exercise too. How much do I need to exercise to work off my my supersized meal? And just a good thing to keep in mind that if we're looking for weight loss, and that's one of the reasons why we're motivated to do some more physical activity, we also need to help our body out with healthier food choices. And one thought is that you know, you can think about it in terms of calories. So if you have, say, a pound of body weight, it would take a deficit of 3,500 calories to equal a pound of weight loss. So you need a deficit of 500 calories over the week. So some of that deficit may come from physical activity, some of it may come from diet, and the combination together of making healthier food choices, lower calorie meals, fewer snacks, along with the exercise, that is going to help people reach their weight loss goals sooner. And another thing to think about in terms of preventing lows with exercise is sometimes, you know, we do need a little extra carbohydrate coming in, but if our goals are really to lose weight, we may do better to reduce insulin. So again, always talk with your healthcare provider about reducing insulin for exercise. In general, you would want to reduce your mealtime insulin doses, and not by a lot. You might consider 1 to 2 units, and you would choose the meal that was the closest to the activity. So say you know you're going to be going to the pool for water aerobics class in the morning, but you eat breakfast and you take mealtime insulin, you could reduce that mealtime insulin dose 1 to 2 units and see if that helps prevent lows or prevent you from needing to take extra food during your workout to prevent lows. And again, talk to your healthcare provider and keep good records. Check blood sugars before, during, after the exercise, and keep records of, you know, your insulin doses as well, so that your healthcare team can really help you decide what works best for you. The intermediate acting insulin, such as NPH or 70/30 or 75/25, that have a little bit of a mealtime component to them, they could be reduced as well, possibly 2 to 4 units. But this just really can involves some planning to know in advance that you're going to be extra active that day. And then the long-acting insulins like Lantus, Levemir, Basaglar, Toujeo, Tresiba, we would rarely be adjusting these doses unless you're doing an all-day activity, unless you're doing some type of real athletic training and events, then these doses might be adjusted. But again, talk to your healthcare team, see what their recommendations are. And sometimes we find that with longer duration of activity, we just really do need more food. So again, checking blood sugar beforehand. If that blood sugar is in the green zone and you've exercised kind of moderate intensity after 30 minutes and you're going to keep going, you might need another 15 to 30 grams of carbohydrate. Or a longer duration event, like a 60-minute thing, you might need 15 to 30 grams of extra carbohydrate along with a little bit of protein to help sustain that carbohydrate. And then if it's a long event, it's more than 60 minutes, it's higher intensity, you might need the snack and also to adjust the insulin. So sometimes people do a combination of both. So what is the best approach if you're on insulin and trying to manage blood sugars with diabetes? Should you adjust insulin? Should you snack more? And again, there's many ways to go about it, so talk to your healthcare team. If you're doing the planned activity, you're trying to lose or maintain weight, you might consider insulin adjustments. If you're doing a long duration activity or it's kind of spur of the moment, unplanned, then snacks may be more realistic for you than adjusting insulin. And actually, sometimes people need to do both if they're really, it's a long endurance event. And then there are times when you just really want to be cautious with exercise. So with diabetes, any kind of sick day, you have the potential to have blood sugars going high, going low. And so exercise would just throw another variable into that. So we recommend, with a sick day, especially something with a respiratory issue, definitely consider not exercising that day. And then if blood sugars are high starting out, we would recommend proceeding with caution when blood sugars are over 250. It's best when blood sugars are high if you can check for ketones. If your body is producing ketones, then it's best not to exercise. If there are no ketones and the blood sugar's over 250, it could be okay to proceed. Just want to be sure the blood sugar is coming down, make sure you're staying hydrated, and keeping an eye on the blood sugar. If with type 2 diabetes, blood sugars over 400, I would recommend not exercising, or if it goes over 400 while you're exercising, to stop exercising. If you have type 1 diabetes and it's over 300, again, check for ketones. If it's over 250, if there's ketones, do not exercise. If there are no ketones, the blood sugars are high, then just check the blood sugar within 5 or 10 minutes after starting to exercise and make sure the blood sugar is coming down. If the body's in a state of stress, possibly not enough insulin in the body or an illness and there's ketones, then exercise will only drive the blood sugars up and complicate the ketone situation. And then just another note about being prepared. So of course, we want you to exercise, we want you to be safe, we want you to know what your blood sugar patterns are, we want you to be able to treat a low and stay hydrated. So all of these things, when you exercise, is a really good idea to have a way to monitor your blood sugar, whether that's your meter and supplies or a continuous glucose monitor. Good idea to wear a medical alert that says you have diabetes, just in case you need assistance. They would look for that. And then making sure you have a quick acting carbohydrate source and have a little bit more than you think you might need. Sometimes the activity, the combination of activity and insulin can create a situation where you need more than one glucose tablet. And that's one thing that I think about a lot is people often think that one glucose tablet should fix a low blood sugar when they usually have only like 3 to 4 grams of carbohydrate. You need 3 to 4 tablets to treat a low blood sugar. So carry something with you that you can just stick in your pocket or a fanny pack. Keep your phone with you in case you need to call somebody for help. And then stay hydrated. So bring water, maybe bring more water than you think you need to have. And then always wear good shoes because we know that taking care of the feet is super important when you have diabetes. So that's the information on how to stay safe with exercise, why we should exercise. The next step really is to think about what you would like to do for exercise, how to get started. And we have what we call SMART goals to help people really set doable goals for themselves in a framework that will help them succeed. Oftentimes, and I'm guilty of this myself, I just want to hurry up and, get to walking every day, 60 minutes a day and something intense, and then, I'm burnt out or I've strained something and I have to go back a little bit. So when you're thinking about what your plan is going to be, set a SMART goal. And what that means is being specific about what you're going to do, have a way to measure it, make sure it's attainable. So again, don't be like Sandy and think you want to jump out the door and walk 60 minutes, 7 days a week. It just never happens that way. So we start with maybe 3 days a week and maybe 20 minutes, and we build on that. We get into the routine. Make sure it's relevant for you. There's lots of things I think I would like to try, but when I think about the reality of it, I'm not so sure that it would fit into my lifestyle. And then have it be time bound so you can check in on yourself. I'm going to do this for a week, and then I'm going to revisit and I'm going to see how I did. I'm going to revisit and reset my SMART goals. So some examples of some SMART goals would be something simple like I'm going to dance to 2 songs after breakfast 4 days a week, or I'm going to go to the gym 3 days a week. I might swim for 20 minutes, 2 mornings per week, and so forth. So think about where you're at, where's your baseline, how can you increase that baseline to a level that's attainable, and then always keep notes. You just make a little, write on your calendar, walked 20 minutes, write on the calendar, I went to the gym. So you can go back at the end of the week and assess. And pretty soon you've got a routine going, and then the hard part is over. You've really developed a routine and made it part of your day and your week. So be patient, one step at a time, and you can get there to your goals, but it does take time. The body needs time to rest in between. It's bouts of exercise and build muscle and to build stamina. And so, yeah, being patient is important. Okay, we've come to the end of that discussion. If you have any questions, you can put the question in the tab on your question tab on the toolbar, or if you just would like to share a diabetes management tip that has worked for you.
Well, and Sandy, if you have any other final tips or anything that you think of, that would be great. Otherwise, I'll go ahead and let the group know as to what our next presentations are that we have coming up.
Okay, great. Yeah, I do have a couple of just last minute thoughts. One is, a lot of times people ask me, I have bad knees. What is the best kind of exercise I can do? I try something and then I don't stick with it. The best thing you can do is something that's fun for you. And so sometimes if you have these additional challenges, you do have to maybe talk to your doctor, talk to a physical therapist, work with the people at a gym. Water exercise is great for joints. Lots of gyms and YMCAs and rec centers have classes in the water that are really good. And then, of course, things like cycling on a stationary bike may be an idea for somebody who has a little trouble staying balanced. So really kind of reaching out to other specialists and resources to find the type of exercise that may work for you. And then again, the best thing that should work for you is the type of exercise you enjoy. So it sometimes takes a while to find what that is, but with time and with effort, you can certainly find the exercise that suits you. And thank you so much for your time. It's been my pleasure to have a discussion with you all.
Yes, thank you so much, Sandy, for your time tonight. Here on the next slide, just so everyone can see, we do have a couple more webinars here coming up. Here in June, we'll be just kind of diving into, different things about diabetes. Is it fact or fiction with that? So we've all seen a lot of stuff online, wondering what's true or false. Please check that out. And here in July, we have our advanced diabetes nutrition class that will also be presented by one of our diabetes educators, dietitians as well. And if at any point, if you have any other questions about what else we offer, you can check us out on Facebook, or also reach out to your coach as well. If there was anything that Sandy mentioned today that you have additional questions for, or else you're wanting to know how to make this work for you, please talk to your coach. I promise they want to talk about all of that as well. But again, thank you. Thank each and every one of you all so much for joining us tonight. I hope it's been encouraging, and thank you so much. Have a great rest of your day. Bye-bye.
Thank you.